I'd like to tell you a story. But not just any story. I want to tell you the kind of story that has you spellbound. Edge of your seat, bated breath, desperate to hear the ending sort of story. But there's a problem. You see, I'm here to talk about one of the least sexy topics in medicine. As a medical student, I didn't actually know what public health was, because everyone said you could pass the exams without going to any lectures. All I can remember from my last-minute cramming is a picture of a massive bathtub. Imagine that all the people with a disease are represented by the water inside the bath. That's prevalence. The water flowing in through the taps represents all the new cases of a disease. That's incidence. I passed, but only just. Like most medical students, I was determined to be in the thick of it, up to my neck, inside the bath, handing out life jackets, saving lives. But a lot of public health is upstream, learning how to turn off the taps. It wasn't until I dropped out of medical school that I started to appreciate public health. When you can't get the treatment you want, it brings it home that we can't afford to just keep diving in, patching everyone up all of the time. We're all living longer with more chronic conditions. The water is gushing in. If we don't find ways to slow it down, the NHS is facing a tidal wave. The future health of millions of children, the sustainability of the NHS, and the economic prosperity of Britain all now depend on a radical upgrade in prevention and public health. I didn't write that. NHS England did. Shortly before, public health funding was cut by £85 million a year. If we're going to get public health the attention it deserves, we've got to find a way to get people hooked. We've got to turn it into a blockbuster of epic proportions. So I looked to Hollywood for inspiration. One of the most successful stories of all time came to the big screen in the same year that I skipped my first public health lecture. Since 2001, Harry Potter books have sold over 400 million copies. 8 movies have netted $8 billion. And I suspect that any Brit under the age of 30 who doesn't know what it means to ride a Nimbus 2000 or have a crush on Hermione Granger has probably had their memory wiped by an Obliviate charm. So, what is it that has made the story of Harry Potter so successful? If you boil it down to the fundamentals, I reckon there are 3 core ingredients. Firstly, you need a really scary baddie. He who cannot be named, aka Voldemort. The most terrifying of his allies are the dreaded Dementors. Get too close, and every happy feeling, every good memory will be sucked out of you, leaving nothing but an empty shell. Nasty. Secondly, we need a likable hero or heroine. Harry Potter and his trusty band of sidekicks. Harry doesn't look like much to begin with, but looks can be deceiving. Thirdly, and most importantly, magic. Without the mysteries of magic, powerful supernatural forces, it would simply be a bunch of kids in pointy hats, waving sticks around. So, can we use this recipe to create a contagious public health idea? First, we need a baddie. How about an invisible yet debilitating global epidemic which affects 1 in 3 of us in this room? 1 in 10 of us severely. It can strike at any time, but typically when you're at your most vulnerable. It saps your strength, makes it impossible to work, to manage relationships, even to follow simple instructions. And yet, you're so tired, you don't even have the energy to ask for help. While it may have no physical signs, it quietly multiplies your risks of diabetes, heart disease, infection, and suicide. Believe it or not, I'm not talking about imaginary dementors, but the very real condition of insomnia. If you think sleep problems sound trivial, that's part of insomnia's cunning disguise. After a few nights of short sleep, we tell ourselves, we'll survive, we'll push through. But with every hour of missed sleep, we get slower. We make more mistakes. Sleep debt builds up over time. Sleepiness causes more accidents from alcohol. Sleep-deprived doctors harm more patients, but few will admit it or even be aware of it. If only we could see the miraculous things happening in the sleeping brain, I don't think we'd ever want to cut it short. When we learn new information during the day, little bulges appear on the edges of brain cells. Dream sleep allows for the gardening of these nascent memories. We prune back the unimportant ones, allowing the best ones to thrive, creating solutions to problems while we sleep. There's spring cleaning too. Beta amyloid, a particularly nasty toxin, gets swept out of the brain during restful slumber. If you neglect sleep, you're not only reducing your capacity to learn, you're upping your odds of memory loss and dementia. But when you're in insomnia's grasp, you can't get enough sleep, no matter how hard you try. Insomnia hijacks your emotional control centers. The part of your brain responsible for recognizing threats, the amygdala, gets hyper-aroused. But at the same time, the part of your brain responsible for logic, planning, and self-control, the prefrontal cortex, takes a siesta. The result? Your emotions go haywire. You're hypersensitive. Your fight or flight stress response is permanently switched on, flooding the bloodstream with stress hormones, raising your blood pressure, exhausting your immune system. To make matters worse, many of the things that we do when we're tired, skipping the gym, napping, having a glass of wine or 3, actually make sleep worse, perpetuating this negative cycle. If Voldemort had created a solution for insomnia, he would have created sleeping pills. Why? Because they often do more harm than good. Sleeping pills don't address the source of your worry or your negative sleep habits. They can numb the mind, and they might give you an extra half hour of sleep if you're lucky, but they can also cause confusion, memory loss, accidents, falls, depression, addiction, and, somewhat ironically, when you stop taking them, rebound insomnia. Last year, around 12 million prescriptions to treat insomnia were written by GPs in England. That's one for every GP, every day of the year. How can we tackle a problem of this magnitude? And who on earth can we get to help? I do have someone in mind.
Hello there, Sophie. I am the prof, and I'm here to do everything I can to help you sleep better. Now, you may be thinking, why should I trust you to tell me what to do? Well, everything we do here at Sleepio is rooted firmly in scientific evidence.
Meet the prof, our hero. Digital sleep expert with program Sleepio. The prof may look like a diminutive figure, but looks can be deceiving. The prof and his narcoleptic dog Pavlov are powered by over 30 years of clinical psychology expertise. You see, there is a very effective alternative to sleeping pills, and it consists of learning cognitive techniques to ease the racing mind and behavioural strategies to help reset sleep patterns naturally. This combined cognitive and behavioural therapy approach, or CBT for insomnia, has been around for decades. But with only a handful of trained providers, it's virtually impossible to access in-person therapy. The Prof was the brainchild of a Scottish professor of sleep medicine, Colin Espy, and a former insomnia patient, Peter Hames. The two of them were deeply frustrated that the ingredients of CBT are widely known about, but virtually inaccessible. So they taught the Prof everything he knows, including his endearing Scottish accent. So, scary baddie, check. Hero, check. But what about the magic? Magic can refer to supernatural forces, but it can also refer to something fascinating, awe-inspiring. The Prof's magical power is the ability to deliver not just information or entertainment, but digital medicine for sleep. Digital medicine uses web and mobile technology to deliver outcomes for patients in a personalised way that is as effective as the gold standard treatment for insomnia, in-person CBT, and yet it is fully automated. Let's just think about that for a moment. It means that I could give someone battling insomnia access to this Sleepio program today, and 2 months later, they would be as likely to recover as if they'd been to see a therapist. But unlike a therapist, the Prof isn't limited to seeing 20 patients a week or 30, but hundreds, thousands, or even millions. And that's not even the most magical bit. Just now, I told you that poor sleep messes with your emotions. But what if the reverse is true? What if, by transforming someone's sleep, you could also transform their mental health? Earlier this month, The Lancet published the largest ever randomized control trial of a psychological therapy. Over 3,700 students were randomized to either receive Sleepio or a control. 5 months later, the Sleepio group was sleeping better. But that's not all. They were less likely to be anxious. They were less likely to be depressed. Better sleep had even led to a reduction in the early markers for psychosis. These tantalizing results suggest that digital sleep medicine could be a powerful tool to turn off the taps to mental health disorders at an unprecedented scale. But there are people who don't believe in magic. People who think that only a doctor can administer a medicine. Perhaps they've never encountered insomnia. I've never tackled insomnia either. But I have been in a situation where I desperately wanted help with my mental health. In my case, as a student, it took me over 12 months to pluck up the courage to ask for help, and less than 12 minutes to be told I'd have to wait till the following year to see a therapist. I had to wait to get worse, to get help. I dropped out of medical school long before I tried CBT. All mental health disorders, including insomnia, have something in common: losing control of your emotions. And if you don't feel like you, you can't act like you. Like dementors, mental health problems suck out your motivation. You just get these tiny windows of opportunity where you have the right level of determination or desperation to ask for help. And in that window, every delay, every hassle arranging or travelling to an appointment, every time you face the shame or stigma of admitting to a stranger that you can't cope, is another reason to abandon the effort. I'm not saying that digital medicine is a magic bullet for mental health. There is no such thing. Learning cognitive and behavioral habits is really hard. Doctors and therapists can be phenomenally helpful, but regardless of how brilliant they are, 99% of the time, as soon as you walk out of that door, it's up to you. And it's bloody hard work. So to have instant access to something which democratizes medical knowledge, which teaches you techniques, tracks your progress, supports you 24/7, that empowers you to take back control, that's the magic of digital medicine. I wanted to tell you a story, but actually all I've given you are some ingredients. The fact is, this is a story which is only just beginning. Like Harry in his early years at Hogwarts, digital medicine is yet to unleash its potential at scale on the Muggle world. But like every good story, there's a cliffhanger. Next month, the NHS in London will launch a pioneering new mental wellbeing service, and it's entirely online. For the first time, Londoners with poor sleep will be able to log on at no cost and help themselves to digital medicine, anytime, anywhere. Take that, insomnia.